the child with.
Meanwhile, the result of the food insecurity is resonating beyond Nigeria's northeast. 2-year-old Emmanuel Sunday Akpan suffers from a severe form of malnutrition. The Cross River State government, in a bid to address the issue of severe malnutrition in remote communities, launched a nutrition monitoring task force headed by the State Commissioner for Health, with the task of monitoring where malnourished children can be identified.
So this child, since I was delivered this baby, there is no, the father left us since 2 months, after 1 month plus. So I was suffering with the baby was not healthy. So after then, so until December, so the baby was sick, did not eat. So that is where the baby started to lean.
So last year was a very, very tough year for families and indeed children all across the country, and I'm sure all across the world. While the concentration remains on COVID-19 and getting people tested and trying to build isolation centers, test molecular labs and the rest of it, our children who have been shut down, families who have lost their livelihood, and their children are being underfed, uncared for, are beginning to show very strong signs of malnutrition. We've been going through communities today as part of our monthly community assessment, as part of MSCH week, where we go to check for children, their nutritional status, and also try to see their immunization card, their ANC cards for pregnant women, and other indices. And we have picked up several severely malnourished children, children who are suffering from marasmus, marasmic kwashiorkor, and several others have been picked up from the community. Most of those kids are both 2 years old, but they are unable to sit, not to even talk of working or talk, or their cognitive reasoning zero, cognitive development, mental development, it's almost not happening because of the severe malnourishment that they do have. So basically, we are beginning to find these children all around, and it's part of the aftermath or part of the fallout of the COVID-19 on society and, of course, on children in society. For us as a government, we have a lot of work to do to try and cover up and meet up where we used to be. It used to be very difficult to find malnourished children in Cross River State, in Calabar. It used to be very difficult to find malnourished children in our villages just because we are close to the riverine area. And even though they might not have so much money, even though they might be amongst the very last quartile in society, however, they still had access to their farmlands, they still had access to their petty businesses that could put food on their table and help the nutritional status of their children. But from what you can see now, because all of that was put on a hold because of COVID, families are not able to take care of their kids, and we're having more and more children come down with severe malnutrition in communities.